Recently, you may have read about 23% increases in individual health plans in the state of Oregon. Oregonians continue to face rising health care costs. On top of increases in the past years, these increases are becoming such that many Oregonians can no longer afford their health care coverage. The challenge becomes, how do we reduce costs or slow down the rising cost of health care, maintain quality, and improve access for more Oregonians in their health care? Keeping quality and improving access and reducing costs are very difficult challenges that we face. But one thing we know, Obamacare is not the answer. House Republicans will not support more bureaucracy and control over your health care or your insurance. House Republicans will not allow special interests to develop more and more control in the way government takes over your health care. This brings us to a current topic that's going on around the Capitol, and that is the healthcare exchange. What is a healthcare exchange and how does it impact the average Oregonian? Well, House Republicans are making sure that in the healthcare exchange, you will still have a free market choice. Actually have an exchange choice and an outside exchange choice, a dual market situation where private healthcare insurance will still be represented in that exchange. House Republicans will stand strong to make sure that that is in the exchange. We are also working to make sure that the exchange will be accountable to the legislature and that it will just not be run by some bureaucracy who makes all the decisions about health care and what the exchange does. These are two principles that we will stand very strong on to make sure that this exchange is something that will help Oregonians and their health care coverage. We are working to make sure that individuals and small businesses can obtain health insurance in the exchange or outside the exchange, a very important competitive principle. There is a lot of information out there about the healthcare exchange, but please understand, based on the federal Obamacare mandate, if we do not do this here in the legislature, the federal government will force upon us an exchange that we will probably not appreciate as Oregonians. If it comes from the same creative think tank that brought us Obamacare, I believe many of the free market and choice principles that House Republicans are trying to put into this exchange will disappear. House Republicans are working hard to make sure that the federal mandated programs that are being pushed upon us are crafted with free market principles. We will do it to the best of our ability, and we appreciate your support. We look forward to having your feedback, and please allow us to have your feedback. And thank you very much for your time.